Start.
Good morning, I'm Dr. Atif. How can I help you, Mr. Ghulam?
Doctor, this my shaking has started to become worse. Doctor, I think the drug is not working anymore.
Okay. And so can you tell me more, explain me more about this shaking you have?
Well, doctor, I've been diagnosed with this Parkinson's disease for 2 years now,
Okay.
and things seems to go very well until the last 2 weeks. It become very bad. I think the pills
Two
is not.
weeks. Mhm.
Yes,
Okay.
the 2 weeks ago,
Okay.
this shaking
Okay.
started to become worse. First, it started with shaking, and now I can't even move in the room. I think the pills aren't working anymore.
Okay. And I can understand it may be very difficult for you. Just tell me what medication exactly you are taking for this Parkinsonism.
Taking tablet called Cinemet, this 100 over 10 carbidopa levodopa. I'm taking it 3 times per day.
Okay. And Mr. Ghulam, do you have any past medical history with that? Any medical problem with that other than this?
I have this diabetes, high blood
Okay.
sugar.
And are you taking any medicines for this problem,
Yes,
diabetes?
I'm taking this metformin 500 milligram twice daily, and this
And
glycoside 30 milligram once daily.
it's
So the doctor is give me something for my lazy stomach. They said I have this lazy stomach. They give me drug. It's called metoclopramide 5 milligram 3 times a day.
okay. And are you taking these medication properly, right? And your
Yes,
Parkinsonism medication also you are taking properly?
yes, yes.
Okay. Just tell me that you have any numbness or weakness in your limbs?
No,
Any pins and needles, feeling of pins and needles?
no,
Any syncopal attack or drowsiness?
no,
Okay. And any slurred speech you have?
no.
Okay. So just I wanted to ask about your other things about your mood nowadays. Is it your mood fine or is it being affected with this problem?
I'm fine. I'm fine.
Okay. And since what kind of work you do? Are you doing any work or you are at home?
But I'm retired. I live alone.
Right, right. Uh, just tell me that do you have a problem while driving?
I stopped driving a long time ago. Doctor told me it's not safe to drive.
Fine. Okay. And what exactly you think? What may be the problem going on with you with Parkinson? You know that you have Parkinsonism. So what exactly is happening with you? Any ideas you have?
I think that this drug is not working anymore. The doctor told me that once you feel that this drug is not working anymore, come back.
Okay.
So,
Okay.
but I don't know, doctor. This worked very quickly. Like this drug worked very good in the last
Okay.
2 years.
Anything with this you bothering you particular?
I'm afraid I might fall and nobody help me.
Fine. Okay, I can understand. And anything specific you have to ask from me or you want from me
So I want
this
you
particular?
to refer me to the neurologist quickly as soon as possible and give me to increase the drug dose if you can until I see him.
Okay. Okay. Before going further, Mr. Ghulam, I just want to have. I will be checking your vitals, all the blood pressure, and SpO2 and pulse rate, but I will be doing your examination. So is that okay? I can proceed further.
Yeah.
Okay. The examination basically, I will just start by moving your eyes. I will just moving my finger and just you move your eyes. Okay. So
Yeah.
just okay. And now I would like you to just make your hand straight so that I can see just like straight like this. Okay. And just you can touch my touch your nose and then touch my finger with your finger. Is that possible? Fast. Okay. With the other hand. Okay. Just one more step I wanted to ask. Can you do move your fingers like this? Okay. Thank you very much, Mr. Ghulam. Thank you very much for your cooperation. And we will be discussing about this problem. Since you know that you have Parkinsonism, which have these kind of tremors, basically tremors, and so for that, maybe this drug is not working well on you, which is one of your concern, and maybe you need to have additional drug with that. So I really want you to. It will be better for you to be seen by a neurologist. Okay, so I will be making a appointment with the neurologist, and so he may be increasing your drug or adding some other drug with that.
Can you do it
Okay.
for me, doctor?
Yeah. I will be booking appointment for you.
I mean, can you increase the drug dose for me?
Exactly. It is actually this should be done by the concerned neurologist because that is much better to do, and so that's why I'm referring you for that reason.
Okay.
Okay, and also I will be checking your investigations just to see how the your other blood and organs are functioning, and also I will advise you that since you know that you are not driving, so not to drive and to be on safe, like when you are coming from the stairs and where you are taking bath, just to be on the safe side with that. After appointment with the neurologist, I would like to follow up with you if it's okay for you after 1 week.
Okay.
And after that, any problem happens, like they are more shaking or there is any other issues, you can call me on the emergency number.
Okay.
Anything you want to ask?
Doctor, when I'm going to see the specialist and neurologist?
Neurologist, I will make as soon as possible. I will be arranging appointment today, right now. So I will, since you have a problem with transport, I will also arrange an ambulance for you. Or if you have a driver, you can go. But I will arrange today as soon as possible.
Okay, doctor. Thank you.
Thank you very much.
2 minutes left.
Sorry?
2 minutes left.
Okay. It's because I'm worried about time also. That makes me more anxious.
Doctor, I fell down the last 2 weeks. I'm afraid I will fall down again.
Okay, so the neurologist will increase your dose, and then we will see if it's being better. If it is not being better, then definitely, if there is a feeling of falling down or anything, then you have to get observed and get admitted for that reason. If there is any numbness or weakness, or if you are feeling that you are feeling drowsy or falling down, then you have to get observation and admission for that reason. You moved your hands till 1 hour left. You are not tired. I got you.
I'm out.
Okay.
This patient, Parkinson's disease, he is deteriorating. This is known Parkinson's disease deteriorating. There are many causes that can cause deteriorating Parkinson's disease. You need to approach them sensitively. It's a very challenging case, but it's expected to come in the exam. It came before in the exam. Make sure of compliance to medication. Make sure of one dose of phenomena. It's called off phenomena. There is the cinemet is not working. The levodopa is by time is losing its effect. There is some tolerance, reduced efficacy of drug. This could be one of the causes. It's called end of dose fading. Make sure what kind of when is the symptoms occur. This sign of end of dose fading, it occur always occur before taking, and this shaking improve and it start to come before the appointment of the next dose, yani 1 hour before the appointment of the next dose. This is the sign of loss of drug effect. But in this case, this is drug side effect. Metoclopramide is anti-dopaminergic drug. This drug is taken for gastroparesis in diabetes and is given to the patient 3 times daily. And because of this drug, he had fluctuation in his he has worsening symptoms of Parkinson's disease. Asking the patient, are you taking the drug properly, as I said before, is not sufficient to decide whether this patient is controlled or not. Taking it properly, how many days are you taking it in its time, and why this patient is deteriorating only within the past 2 weeks, although it's been okay within the past 2 years. You ask about syncopal attacks or drowsiness. This is good. You are asking about autonomic features of Parkinson's disease, but you didn't ask about falls. This is very important. The patient had 2 falls in the last 2 weeks. This is very important to ask about falls in Parkinson's disease. Asking about, do you have problem in driving? First ask, do you drive or not? You should ask this first, and the patient is not driving. So this improper way of asking the question about driving, although it's correct to address driving. Also, asking about the idea in this case could tell him, do you have any idea what could possibly be the cause of deteriorating within the past 2 weeks? Although the patient mentioned it before, you told me you can bring it back. You told me that you said probably the drug is not working anymore. Do you think anything else could be the cause of what happened to you? When you ask about the mood, I was okay. I looked down and I said, yes, it's okay. This is non-verbal cue. You should catch it. This patient has depression, but he's just trying to hide it. He's living alone. There are many social risk factors, psychosocial risk factors. Patient's living alone. He's Parkinson's. He's deteriorating. He's vulnerable to fall. He fell 2 times, but you didn't ask about falling. I volunteered to mention it to you in the end of the consultation. And when I told you that I fell down, you didn't ask me, are you okay? Did you injure yourself? You didn't address this fall of any way. This guy is elderly and he has risk of fall and he has disease that's deteriorating and you don't know what is the cause. These are many risk factors you need to address in this patient. Examination of Parkinson's disease is very challenging. Should be done in 2 minutes. First, inspect face and hands. Inspect the pill rolling and then glabellar reflex. Tap on forehead. It should be persistent reflex. Ask the patient to smile and then check the tone. Try to stay floppy. Tell the patient, try to stay floppy or just move your limbs and then try to move his upper limb and lower limb. And then check the power quickly because you know the power is normal. Just quick one in upper limb and lower limb. Push my hands only. Upper limb and lower limb. It should be normal. Reflexes also demonstrate only one reflex in upper limb and one reflex in lower limb. Triceps and knees. It should be normal. Sensation. Demonstrate only one touch in 4 limbs only. Close your eyes. Which hand I'm touching now? Right or left? Which leg I'm touching now? Right or left? Prayer sign. Ask the patient to do prayer sign. He shouldn't be able to do it. Finger to nose Then my finger, as you said before, you will demonstrate bradykinesia. The gait you didn't do, move and then stop and then turn around. There's also postural test. Postural test, you can view it on YouTube. Postural test for Parkinson disease. You will ask the patient you will push him while you are standing in front of him. While he's standing, you will just push him quickly, push his both shoulders to the back. He should, a normal person, he should go back one step and then stop. The Parkinson will go back like 4 or 5 steps. You should explain to him and then ask him, please, just to hold him in case he started to continue stepping backward. And you will do the same test while you are behind the patient. You will push him forward, both shoulders. You will push him, and he should, in a normal person, he will move one step forward and then stop. But the Parkinson will continue to step 4 or 5 steps. Then you need to protect him from any danger. Also in Parkinson's, you need to screen about cognitive function. Are you forgetting things lately? And if he said yes, you need to do quick memory test. Draw a clock and ask him to point like 10:15, for example. Arranging ambulance for to be seen by a neurologist just is not practical, because you are not explaining to the patient that you are not showing impression that this is emergency. So it's not practical to make all the patients see the specialist the same day just because they want to. You are a doctor. You should evaluate your job as a family medicine to know which case is emergency, which case is not. So just playing smart and admit all the patients, or being smart and give appointments the same day for all the patients, this is not correct. This is not appropriate. If you think that this is the drug is not working enough, of those phenomena, this is not urgent matter, not emergency to be seen the same day. You can refer him urgent to be seen within 2 weeks, but explain to the patient that this is probably because of the drug underdosage, and tell him to protect himself from injury. If you think that this patient is not safe to go home with high risk of fall, you can explain this also. Do anything you want as long as you can justify it very well. Take any decision you want as long as you can justify it in the exam very well. So if you have opinion, for example, that you want this neurologist to be seen to see the doctor to the patient today, because you are living alone and you have very high risk of fall, and you already fall 2 weeks ago, twice this is the last week, I'm afraid if you go home today, you might fail. If you admit this patient for this justification, this is accepted. There is no Quran rule in family medicine that you can take any decision, but just justify it medically very well, not as the patient wish. I hope it's clear now. So this patient management was simply to stop metoclopramide and see if it improves or not, and that you want to talk to him after 5 days, for example, of stopping metoclopramide, to see if the symptoms still present. I want to see you again, and also to give him clear advice about risk of fall, and to have emergency telephone number, a cell phone with him to call anyone in case he need help. And also, because the patient feel depression but you didn't go into it, you can say that I can offer you CBT sessions, cognitive behavior therapy sessions, to address your low mood. You finished the case too early because you didn't address many things in this case. This case has many aspects to talk about, like risk of fall, like cognitive function, like depression. You need to have more advice to the patient about risk of fall, and to have counseling about living alone. Would you like to live in elderly care? You would like to stay in elderly care? There are good people to take care of you. Would like me to send you a daycare nurse to take care of you? There are many things. The patient is living alone and is very high risk of injuring himself. He is old. How about considering checking the risk for osteoporosis as well? You see, family medicine is holistic approach. You need to approach this patient by problem listing. This patient has many risk factors. You need to address them all, and you need to manage them properly. In case you finish in 2 minutes and you still have 2 minutes early, how about checking opportunistic advice? Yani see what this age of this patient. He's 71. You can ask about risk. He had risk of fall before. How about approaching the osteoporosis risk? Ask about healthy food. Ask about exercise. يعني the tolerable exercise according to his condition. Many things you can do if you still have 2 minutes. Don't stay silent. Just talk with the patient. You might notice things. He might be volunteer to tell you things he didn't mention because you didn't ask. Maybe he will volunteer to talk to you. So always don't make this 2 minutes just pass away. There are 2 golden minutes in the consultation. Maybe you missed something. Something is not right. You shouldn't finish too early. Just try to ask, try to summarize, try to repeat again what you have said, and so on, and try to opportunistic advice, even if it's not relevant to the condition. Like, do you smoke? Do you drink alcohol? Do you take? Have you taken any illicit drugs? What kind of area do you live? Just take information and ask, and then you can offer any opportunistic health advice. Since you can ask, for example, you can offer him, how about your age is 71 now, how about checking for colon cancer? There is screening for colon cancer, give you a leaflet for it. You can check for fecal occult blood. You can do this every 2 years, and so on. Just don't stop talking if you finish 2 minutes early, but don't say wrong things as well. Of course, according to the you didn't address the main issue. This is a very challenging case, Parkinson disease, and challenging diagnosis, but unfortunately it came before in the exam, so that's why I gave a challenging diagnosis, so that you will be aware of the possible the scenarios that may come to you in the exam. It could come as new case as well, so prepared for everything. Just make sure that you know the how to approach it. By the way, any elderly who has risk of fall, you need to ask about shaft and death. What are shaft and death? Shaft and death is for indoor activity and outdoor activity. Outdoor activity, this is shaft. S is for shopping. H is for housework. A is for accounting. F is for food preparation, and T is for transportation, whether driving or public transportation. The death is for indoor activity. D is for dressing or undressing. E is for eating. A is for ambulation, walking. T is for toileting, and H is for personal hygiene. As you can see, that outdoor activity is far more advanced than the indoor activity, and the indoor activity indicate that the patient can be dependent, but to a certain degree. But if he can do both shaft and death, then this patient is totally independent. So you need to ask about it and see if the patient can bring his grocery, can do housework. If anything is missing, you can offer him to bring social care or any service to cover his needs. So as a whole, you didn't address the main problem of the patient, and you didn't manage it correctly. This was mainly because you dismissed the metoclopramide. This is maybe because of lack of knowledge regarding antidopaminergic drugs that can flare up Parkinson disease. These are one of the drugs that can cause drug-induced Parkinson. This is very important information. You need to be aware of it. And this patient was this was the patient condition. So I will give you a fail of this case. This case you didn't clear it. I'm sorry to tell you this. As I told you, I'm telling you this. I'm sure if this case came to you in the exam, you'll do very well in it.